panic.
Hi, my name is Kelsey Cadell, and I'm here speaking for Professor Curry. Have you ever been around somebody that never stops going and you just want to go home and take a 6-hour nap? Well, I have, and that person happens to be my sister. She was diagnosed with ADHD at the early age of 3. Today we will discuss what ADHD is, the diagnosis process, and what you can do to lessen the symptoms. Most doctors say that ADHD is inherited, but they don't know if there are any other factors other than genetics. ADHD people have problems paying attention and are overactive, or they have problems with both. ADHD can lead to depression, lack of sleep, or tic disorders. I know from personal experience that lack of sleep accompanies ADHD people because I myself have lack of sleep just due to the fact that my sister never stops going. She never leaves me alone. My mom always told me whenever my sister was younger and she was working on getting her teaching certificate, whenever she would write her essays, my sister would sit in her lap and type on the computer with her. She said after she was done with her essays, she'd have to go back and erase the gibberish that my sister had written because she just could never be still. My mom also told me whenever I was a baby, she always thought that I was sick because I actually slept as a child. What people don't know, however, is that most children that have ADHD often have another disorder. Most of the time, it's bipolar disorder. Fortunately, my sister doesn't have any other disorders besides ADHD. 3 to 5% of people in a class have ADHD, so if you have 20 people in your class, odds are at least one of them are bound to be ADHD. The symptoms for ADHD have to be pregnant for at least 6 months for the doctor to hold an evaluation. The evaluation process involves questions, psychological evaluations, and an IQ test of both the child and the family member. However, people don't know that low IQ does not accompany ADHD. People think that because you're ADHD, you automatically have a low IQ. But most scientists have ADHD, and if it weren't for the ADHD that they had, then they wouldn't have been able to make it through school. Behavioral problems are also a major problem for people with ADHD. For you to fix the behavioral problems of your child, you should set goals and tell the child to go to behavioral therapy. Also, drugs can be taken to help your child. These drugs are taken by mouth, but they also have some negative side effects, so you need to talk to your doctor about which medication is right for your child. You need to involve the child in activities. Sometimes sports help because it teaches the child discipline and how to listen correctly. Some parents like to involve their children in church because it teaches the kids how to be nice to one another, and people are being nice to them also. So next time somebody wears you out and you just want to go home and take a 6-hour nap, just remember that they may be ADHD and you need to have patience with them. If you're babysitting a child that's behaving atrociously, be patient also. Don't get frustrated with the child. And I know it can be hard because, like I've said before, my sister is ADHD, but my father is also too. So I've been around these non-stoppers since I was born. And in this case, practice does not make perfect.